this Wellness Wednesday, we are highlighting a topic that is becoming more popular on social media, but is packed with misinformation. The conversation around male fertility. Despite growing awareness, nearly 40% of Canadians believe infertility is primarily a woman's issue.
So here for more on men's reproductive wellness is Dr. Michael Hartman from Generation Fertility. Dr. Hartman, good to talk to you this morning. A lot of, I think, conversations around whether it's mental health, male reproductive health, et cetera, are about breaking stigmas these days. And part of this conversation, I think, should help that, because there really are stigmas and misperceptions around the role men play in fertility, et cetera. Can you help us then maybe shatter some of the myths and stereotypes?
Absolutely. And I think we've done a good job in trying to raise awareness about female reproductive health. And we've made great progress in that regard. People are freezing their eggs, trying to think about their future. But at the same time, we often overlook the effect of male fertility. And about half of fertility issues stem from the male. Oftentimes, I find I'm having to pull teeth even to get a male involved in having a conversation, being involved in testing for a couple. And the truth is, there's often things that we find in both partners in a heterosexual couple that may be modifiable or optimizable.
That's interesting, because I often think about that. Is it age? Is it diet? Is it genetics? Like, what are some of the bigger factors at play?
So there definitely can be many different factors, including all of the things you mentioned. So age does play a factor in sperm quality, sperm function, and we do know that it can decline gradually over time. Not quite as dramatically as in a female, where there's a really set sort of quote-unquote biological clock, but we do see declines in how the sperm swims and the genetic material and the DNA inside of the sperm, and that can decline with age. There are other environmental factors, so things like cannabis consumption, excessive heat exposure, general kind of body mass considerations as well that may play a role. So there are many different things that can be a factor, as well as genetic factors. So oftentimes, someone who does have reproductive concerns or issues with getting conceiving a pregnancy may have a family history of that as well in the past.
It sounds to me, doctor, like you're saying that there are some things you can change and some things that you kind of can't change in a way here. You know, some of the things, you know, you hear as a man sometimes is, oh, you're taking showers that may be either too hot or too cold, or maybe your underwear is too tight, things along those lines. Can you talk a bit about that? Because you kind of alluded to excessive exposure to heat in one of those points there.
So one of the things that I'll always ask about when taking a history from a male is, do they use hot tubs? Do they use saunas? Do they use anything that may increase the temperature of the testicles above that sort of optimal temperature? The reason the testicles are outside of the body is because they are supposed to be a little bit cooler than the core body temperature. By a few degrees. And anything you're doing, including really tight-fitting underwear, can actually have an effect on sperm. So it's not really just an old wives' tale.
So it seems pretty obvious, sperm count. You can look and see what's there. But in terms of quality, that feels like a whole different world. How do you determine that?
Yeah, and the thing is, it's not like there are clear symptoms in most people of having any issues with sperm quality, quantity, function. So you really only know if you get assessed and do sperm testing. So the basic testing will look at, are there sperm? If so, what the count is, what percentage are swimming, what the volume of the semen is. And from there, we can better determine sort of the basic sort of raw parameters. There is more detailed testing that can actually look at the DNA integrity of the sperm to see if there's a lot of damage to the sperm DNA. And that could be affected by genetic factors, environmental factors, also all the sort of bad habits and considerations we talked about before as well.
Okay.
So interesting.
Yeah, Dr. Hartman, I appreciate this conversation. Dr. Michael Hartman from Generation Fertility. Really important conversation this Men's Health Month. Thanks for joining us this morning on Breakfast. Appreciate this. Nice to meet you. And we have more CB24 Breakfast, including your headlines, coming up right after this break. And Bill's got more on the weather details. That's all on the way. Thanks, Doctor. Nice to meet you.